Welcome to another interview in this series of Let's Talk podcasts, brought to you by the Hazelden Betty Ford Foundation. I'm your host, William C. Moyers, and each podcast I sit down with an expert to discuss the issues that are at the essence of Hazelden Betty Ford's mission, from prevention of substance use and cutting-edge research to treatment, recovery support, and how technology has increasingly become a force of hope and help and healing for people, families, and their communities in the battle to overcome addiction. We are recording this podcast in the midst of the pandemic of coronavirus, and this requires us to take precautions here in the studio. That means that our guest, Dr. Princess Drake, and I are in separate rooms, but our focus is the same today: mental health awareness in the workplace in the midst of a crisis. Dr. Drake is a mental health practitioner at Hazelden Betty Ford and serves as an adjunct professor at the Hazelden Betty Ford Graduate School of Addiction Studies. Among her many other academic and professional accomplishments, she has her doctorate in clinical psychology at Florida School of Professional Psychology. She earned it in 2018. Welcome, Dr. Drake, for being here. And tell us a little bit about your passion for working in the field of addiction treatment.
So much of what we do as a mental health practitioner, we're trained in a generalist sense, where we're able to work with any and every population. But what I love about working with addiction specifically is the people. I have found the most genuine people to work with that are suffering in a way that most people don't understand. And so when I'm able to see a patient transform from the day they come in for detox until they leave with a smile, it makes it all that much more enjoyable to keep doing.
Thank you for what you're doing. We're here to talk, of course, about mental health awareness in the midst of the crisis, whatever the crisis is, but certainly the pandemic and that mental health awareness in the workplace. Why is it important that we focus on mental health awareness in the workplace?
Yes, so much of what we do as practitioners, we serve other people, but oftentimes at the expense of ourselves. And so what I've noticed working during this period of time where I haven't had a day off, unless I was already scheduled, that a lot of the practitioners are stressed out themselves. And so we're constantly trying to give all of ourselves to our patients, but we often neglect our own self-care. And so it's been my priority when I talk to clinicians to not only tell them how I appreciate what they're doing, that they continuously come to work to provide that care, but also that what are they doing to help themselves.
So you're having that conversation with the clinicians, but shouldn't the rest of us who are in the workplace also have that conversation?
Absolutely. So much of what we do, whether you're a clinician, whether you're in housekeeping, whether you're serving food, everyone is important. And during this time where everyone's lives are changing personally, it's even more important that people recognize that what they can do for themselves, whether that's a day off, whether that's taking time with their children, or most of all, sometimes we just need time to ourselves.
So how does a colleague who wants to convey precisely what you just talked about to another colleague, is it okay just to approach that person and have that conversation?
One thing that I love about working for Hazelden is a lot of times they're approaching us, and it's this open conversation that we're having because that relationship has already been built. And so it's, how are you doing? And we know that it goes beyond just saying okay or fine or I'm making it, but they really tell you how they're doing. And then you offer your help in any way. Is there anything that I can do to help you in that way? Though I may not have any power to let someone have a day off, we may talk about just different self-care techniques that they can use.
What are some of those self-care techniques?
One of the things that I always tell people, I like to practice what I preach. And so oftentimes it's, planning time for yourself, whether that's, doing your hair or nails or watching a movie, listening to music, drawing, reading. Whatever helps that person come back to a state of calm for themselves is what they can use. Self-care doesn't have to be this big thing or big ordeal. Oftentimes we think about self-care as this, it has to be for an hour. If it only takes 5 minutes to do a meditation or a prayer or what have you, that's all sometimes that we need.
So in these times, we've got the pandemic of coronavirus, and it's been with us now for about 4 months here in the United States, and it's been with us at Hazelden Betty Ford in terms of our awareness and the actions that we're taking during that same period of time. We've had the civic and racial strife that's occurred on the streets of our country, and you and I are in Minnesota. This is really where a lot of this started, of course, as we know, of late. We've got the economic downturn, and even we've had at Hazel and Betty Ford the need to take some actions, in terms of watching our expenses and so on. That's included furloughs. I mean, this is a unique time, isn't it?
Yeah, it is, because we're seeing it hit from every single front, not just at work. As a person of color myself, it has been extremely stressful when it comes to managing my own frustration or agitation with what's going on, but also being an advocate for change. And so oftentimes that takes me to be uncomfortable to talk about these things, whether in the workplace or at home. I'm very fortunate enough to work for a team where we've been very transparent about what we're going through and being able to help each other so that we can be effective for our patients.
Thank you so much for bringing it up. I agree with you. Hazel and Betty Ford has been good on recognizing these unique dynamics and communicating it and make sure everybody's inclusive. We're Hazel and Betty Ford. We get a lot of people watch these podcasts that have nothing to do with our organization. They just want to glean the wealth of information that people like you have. What would you tell an organization or a company, a for-profit or a not-for-profit? How can they better instill the dynamics of healthy mental health into their workplace?
That's a great question. One of the things I would probably tell them is making sure that they have available services for their employees, such as an EAP. And if someone doesn't feel comfortable using an EAP, being aware of the mental health services that are in their direct community. Secondly, I would offer up that person to recognize, to be transparent, sending out a message, letting them know that they recognize that their employees, staff, or faculty may be having a difficult time right now, and offer their support in any way that they can, whether that's a day off or having someone assist them in terms of their day-to-day activities. Thirdly, I would also encourage that specific organization to continue to advocate not only for their employees, but what they do or provide in terms of services.
Thank you. On a personal note, or getting closer to home, what is it that you specifically find most rewarding in regards to working with people with co-occurring disorders?
What I find to be the most rewarding is recognizing that it's just not about addiction, it's just not about mental health, it's both. And recognizing that they play off of each other more times than we often think. We know that statistically you're more likely to see someone having both mental health and substance use. And so when you tackle both of those, I always say you're getting a double for your trouble in a way, because you're increasing your probability of staying sober. And so why not take care of the mental health concerns that a person may have, whether it's a true mental health disorder or just additional stress.
You know, on that note, and I probably should have asked this first, but what do you see going forward, given everything that's happened in the country and continues to happen? What do you see in terms of demand or the need for substance use services and mental health services, not just at Hazel and Betty Ford, but in the larger community and in the larger country?
I know that I was recently watching the news, and they talked about this mental health pandemic that's going to occur after COVID or even during. And so recognizing that you're going to get a wave of individuals who either have not sought treatment during this time because of needing to isolate or quarantine, but also recognizing that their caregivers are also going to need that assistance. And so I anticipate that there's going to be a wave of individuals who've either never sought treatment before or are seeking treatment again, because we have people who have returned to use just because of the current stress. And so being prepared for that.
And on that note, before we close, some people who will be tuning in might be looking for help. They might be looking for a wise word from you or some avenue of opportunity to take that first step, or that first step again. What is the message you have in closing for people who are struggling, whether they're in the workplace or not?
That it's okay to not be okay. And I often tell people, even therapists need therapists.
And that's true today, and that'll be true going forward.
Absolutely.
Well, Dr. Princess Drake, thank you so much for bringing your passion, your expertise, and your ability to communicate so effectively to our audience today. It's been great to have you as part of our Let's Talk podcasts.
Thank you so much for having me.
You're welcome. And thanks to all of you for tuning in. Be sure to keep coming back for more in our series of Let's Talk podcasts. On behalf of our executive producer, Lisa Stengel, and all of us at Hazel and Betty Ford, please stay safe, stay healthy in these times and always.